Good morning. I'm Dr. Velasquez, the health officer for Spokane County. And today, next to me, I have Emily Bauer, community liaison at Inland Northwest Behavioral Health. And she's here for a very specific reason. May is Mental Health Awareness Month. And we want to make sure that we hear from one of our key providers in the community, particularly given that the theme for this year is turn awareness into action. So the more we all know, the better off we are. So I'm going to say welcome to Emily and ask you, tell us a little bit about Inland Northwest Behavioral Health. A lot of us have been there, a lot of us have seen the building, but I know some people go like, oh, I don't know what that is.
Right.
So tell us a little bit about it.
Yeah, well, thank you so much for having me here today. It's a pleasure to speak on behalf of Inland Northwest Behavioral Health. And right away, I will say it's really easy to reference it as INBH, just since it's kind of a long name, so you might hear me say that, and that's just the shortened version. So really what INBH is, we have two main services in Spokane here. We have an inpatient psychiatric hospital, and that's right downtown Spokane on 5th and Brown, just beneath the Sacred Heart area. And then we have an outpatient treatment center. It's called Branches Spokane. So anytime you see Branches Spokane, that's just our outpatient service, and that's group therapy. So I'll kind of break down the two kind of distinct services a little bit here.
And where's Branches, by the way?
Yes. So Branches is on Atlantic Street. It's in the Rock Point East building, which is really close to the arena. So just about a mile away from the hospital going north.
Wonderful. Okay.
Mm-hmm. So starting with inpatient, like I mentioned, INBH, we have 100 beds at our facility, and that's for ages 12 through 17, adolescent, and then 18 and over adults. So kind of what that looks like is we have 25 beds reserved for our adolescent patient population, and then we have 75 beds for adults 18 and over, and that's in 4 distinct units. So that's kind of what the hospital looks like, but really what's important to know is that we are open 24/7 for walk-in assessments. So really what that means is anytime you or someone you know is experiencing a mental health crisis, you should and can walk right through the doors. So even if it's in the middle of the night on a Sunday, you can come in. You do not need a referral, and we are accepting of all insurances or no insurances. So we don't want, time of day or ability to pay to be a barrier to receiving mental health care. We really are here to serve our population.
Well, actually, I'm glad you mentioned that because there are a lot of misconceptions around mental health and mental health services in Spokane. I think you just hit 3 of them. One is that we don't have facilities for youth and young adults, and you just talked about the 12 to 17, which it service. Second, that you need an appointment for everything. We just mentioned that that's not the case. You accept walk-ins. And third, that you have to seek services during business hours. And you just talked about that too.
Yes.
That's not the case. What other common misconceptions around mental health and the provision of services should we clarify for the audience?
Yeah, that's a great question. I think beyond kind of what we already talked about, I think probably the biggest misconception that we run into is folks feeling like they're maybe not worthy or qualified for care, that they feel like you have to be extremely ill, that you need to be in, the worst condition possible to seek out services, which is of course not the case. Even though we're talking about an inpatient setting where we are talking about a high level of care there. So, these are folks who are experiencing true crisis for mental health. There are plenty of other levels of care that may be appropriate for folks who are experiencing a degradation in their mental health, but are not yet at the point of hospitalization. And that's really where Branches Spokane comes in. We do outpatient therapy, so that's appropriate for folks who maybe have been seeing a one-on-one therapist their whole life or have never been to a therapy appointment ever and are looking for a place to start. So really there is an appropriate level of care for anyone and everyone, and you do not have to be very ill, and in fact, proactivity is really one of the most important things you can do.
So that brings to mind 2 things. One, there's a continuum.
Yes.
And not everybody's at the same place at the same time. And one of the most common misconceptions is you need to be in a very acute stage, which is part of that continuum to actually seek services, and that's not true. The second word that comes to mind is that looks like a very holistic approach.
Yeah.
You're taking care of everyone, everywhere, whatever they are.
Mm-hmm.
So tell us a little bit about how INBH,
Yes.
the acronym is a lot easier. How do you guys approach that, knowing that there's a continuum, lots of people, different places
Yeah.
at different times?
Yeah, I think it's really about bringing the community together. You know, we're really lucky to work with some amazing community partners and really foster a sense of, you know, health and well-being. So it's making sure that we're communicating back and forth. That's streamlining the level of care for the folks who need it in our community and the rural areas around us. And it's really bringing the patient and their family, their support system in as part of the care team as well. That's holistic recovery. So that's, you know, giving the patient a sense of ownership and making sure they're on board every step of the way, understanding, you know, their diagnosis. Getting that psychoeducation is really important because some folks have never been told, you know, what does it mean to be schizophrenic or what does it mean to be depressed? So really making sure they understand, you know, their own diagnosis, and having, you know, a sense of onus to be a part of that process. And really what that looks like is, you know, balancing medication treatment with therapeutic treatment. So we really like to prioritize that at both INBH and Branches Spokane. So outpatient, even we do medication management. And that's really important because, you know, meds aren't going to solve all of our problems. They're not going to cure all that ails us. And maybe therapy on its own isn't quite enough. So really having the combination of both is so important.
So this is around the person
Yes,
with the person in the center.
absolutely.
And everybody else that is part of that continuum. It could be family, it could be friends, it could be therapists, it could be whomever it is. All of that is part of the recovery. And I'm glad you mentioned the fact that therapeutics are not the only intervention, because that tends to be a misconception for some that if I take X, Y, or Z pills, then everything will be fine. And sure, therapeutic drugs do help, but they're not the whole solution. Getting to know exactly what the issues are or is, depending, and what can you do about it is very, very important. So if I'm a community member, I'm out there, and I say, I think I know someone that, I don't know, they may be acting a little bit strange. What advice would you give community members, family members, or even individuals that are thinking about themselves going like, I'm not sure that I'm okay?
Yeah.
What would you say to them?
Yeah, you know, unfortunately, there's still so much of a stigma attached to mental health, and people can be really afraid to talk about it. So something that we really prioritize kind of in the mental health space in Spokane and really kind of where we are presently as a culture is just inviting people into having a conversation. So what that looks like is just not being afraid to ask the question. You know, day to day, we walk into a room and we greet each other and we say, "How are you doing?" But
Right.
are you really asking, and are you really prepared to answer that? Most people don't answer honestly. So it's not being afraid to sit down with someone, whether it's, I mean, it could be a stranger, but more than likely it's going to be a family, a friend, a peer, and saying, you know, actually, how are you doing? And welcoming someone in to be honest with you. And after that happens, you know, it's just having one resource even to know where to go next if that person does tell you that they're not okay. And it's reassuring them it's okay that, you know, you're feeling this way. It's it happens to a lot of people, probably more than we ever really realize. And, you know, as the receiving end, I don't need to have all the information at all. I just need to be able to be that support person and then maybe know where to go next. So, you know, it's educating yourself a little bit on the resources available to you. And it's knowing that, you know, we are a 24/7 walk-in hospital. So if someone is in need of mental health care, they can come to us at any point in time. It's knowing that 988 is the national crisis line and that you can call it at any point in time, even if you just have a question for you or someone around you, you're not quite sure what's appropriate.
Wonderful. I think that's great that you mentioned 988, but also let me reinforce a couple of things that you said that are very important. It is okay sometimes not to feel okay. It's kind of funny because we talk about physical health very openly. Oh, yeah, well, I have hypertension. But when it comes to mental health, we kind of keep it inside a little bit more, and I understand that. No reason to do that necessarily. Couple of things. There are places that you can go if you have questions. If someone really needs help, you can just drive over there or drive them over there, and they will be taken care of. Age, insurance, and stage are not barriers to any of that with your services.
That's correct.
You mentioned some community partners. I don't know if you want to give a shout out to anyone, but I do know that INBH works with a lot of partners, including us, and we're very grateful for that, because you do fill a very important niche in the community that is critical if we're really serious about taking care of everybody in the community.
Absolutely, and I think that's a great point. I think it really speaks to the reason our hospital was built in the first place. There was a community needs assessment that was done in Spokane, and the community really valued an inpatient psychiatric hospital coming to Spokane. So, we're here to serve the community and to offload our emergency rooms. That's a big part of what we do. These days, we have such a need for care and for treatment. So it's understanding the appropriate levels, within physical health, kind of like you mentioned. We're trying to identify when's the appropriate time to go to an urgent care versus an emergency room. So, similar with your mental health care, we want to help identify that there is a specialized place to go, so that you don't have to go to the emergency room and you don't have to, wait in these long lines, and we're, maybe overworking the system a little bit. So we're really here to help our partners in that way. We work with Providence and MultiCare here in town very, very closely, and we really do, rely on that partnership that we have together. Same with Frontier Behavioral Health. They're running the 988 line here in town, and so, we really love building that partnership constantly. I would say, probably other really important local resources as a community member, kind of just immersing yourself maybe one little step at a time. NAMI is a great organization that we really support.
Can you spell NAMI out for me?
Yes, it's NAMI, NAMI, and they are having...
what does that mean, NAMI?
Yeah, acronym right off the top of my head, I'm not sure I could give you.
Association of Mental Illness. I know they have to.
It. Yeah.
Well, look, Google NAMI, National Association of Mental.
Okay, there you go.
See?
Yes. Okay. I didn't want to misspeak.
Acronyms are great, but they're complicated.
So they're having a suicide prevention walk on June 21st coming
wonderful.
up, just in downtown Spokane at Riverfront Park, and showing up as a community is something that really we can show support and continue to rework, break down the stigma. And so I think the more people that can show up, the better. So I think that's really a wonderful way to get in. Prevent Suicide Spokane is, another organization that's doing great work here. Fail Safe for Life is another amazing organization, and they do trainings to help just day-to-day people understand how to recognize maybe signs of suicidality and other related topics. So, not so short of a list, but just goes to show how much we love working with the community here.
Well, I hope everybody was listening, because a lot of information there. I want to say thank you to Emily, and I want to say thank you to the folks at INBH. I know a lot of the people there. I've had the opportunity to not only tour the building, but participate in some activities. And I know they do a great job, very dedicated, compassionate, knowledgeable providers that are there to help anyone. Doesn't matter who you are, as Emily mentioned. So we're going to say thank you to you again. Hopefully you took note of some of those dates, and we'll probably put those in our information. But I want to say thank you for coming. Thank you to all of the partners that work with INBH, and we will see you all again next week. And I think it's going to be really hot, so mind the heat. Make sure you hydrate. We'll see you again next Wednesday. Thank you very much, and have a wonderful day.
Thank you.